My name is Eric, and we're back on the Vitalcast with Rustam. He is the CEO and founder of Tuktu Care, specifically working with seniors. I always start off the Vitalcast by talking about where Rustam has come from personally. So, Rustam, I'm going to pull it over to you now. Please introduce yourself and tell us first about some of your personal passions and what led you into this kind of business first, kind of working with Foresight Cleantech, working with the Sustainable Development Technology of Canada, and now into Tuktu.
Absolutely. Thank you so much, Eric, for hosting me on the podcast. My name is Rustam, like you mentioned, and I grew up in India, and then I moved to US for my master's in University of California, Irvine. I'm an engineer, and after that, I worked a little bit in consulting as well as in investment banking. I realized that one of my biggest passions, and when we started, was working with people and with communities and with, the large global problems that communities are facing. So I obviously started my first company in the renewable energy space in climate tech, setting up solar power plants across the world. And, I exited that successfully. It was Singapore-based. And after exiting, I became an investor myself. I worked with a bunch of different investment groups and companies, both on the buy side as well as the sell side. And I basically, my last job before Tuktu was working for SDTC, which is the Canadian government's clean tech fund, Sustainable Development Technologies Canada. What's really shaped me is really being a problem solver and really looking at things that can make an impact on society, on humanity. And that's so, as it happened about 4 years back, my dad got dementia and he was going through a tough time. And I realized how difficult it was to be a family caregiver, and decided to build a product around it, essentially a product that brings a community together to support those who need help. So I would say, obviously, my North Star has been to help communities really grow better and do better.
Yeah, kind of gone from the energy sector of helping people, right? Bringing sustainable energy to communities, specifically Singapore.
Correct.
Now, how's your dad doing these days?
He's better. He's in a good place. Obviously, dementia is a long progressive disease.
Yeah.
Over a period of time, it keeps getting worse, but there are ways to manage it. And there's a good social network and a support structure definitely goes a long while.
I love that passion. Do you feel like your father has had a lot of influence over the way that you've developed as a man and into business? Was he a businessman?
Absolutely. I mean, again, typical immigrant family, parents are really hardworking and they try to make it work. And of course, he's been quite instrumental. And I think also watching my mom, support him and be a primary caregiver has been quite instrumental in understanding that, we have some major challenges as a society, especially with the aging population, with, the healthcare crisis that we are currently in. And obviously that's I have a very business in a sort of a finance and product background, so we're trying to align that to do something good there.
Yeah, very good. So when did you start Tuck2 Care? So we know the passion came from seeing your father go through dementia, seeing how your mother has supported with him and through that journey. So where did Tuck2 start? Because I know it's more international now than it's ever been, right?
Correct. So we started in Vancouver. I was in British Columbia, Vancouver, and essentially what happened, we were coming out of COVID. If you remember, 2021 was a hard year for most of us, but it was particularly hard for the older folks and people coming out of hospitals who needed some support at home. And that's where we started, and we realized that what people need more than medical care sometimes is companions. They need to fight social isolation. And we realized that the best people to do that would be the people who are in your community, who are living around you, neighbors and friends and all that. And so essentially that's how Tuktu got created, to create a network of people who can support the vulnerable in the society. And we just made it easier with some smart tools and some technology and AI stuff that could do better matchmaking, that could, create better engagement and communication as well.
So it's mostly online then, right?
Yeah, I mean it's an app, but you can always call us. I mean,
Oh,
we
cool.
we do have a phone phone service as well, but it's the sort of the heart of the technology is online. You can think of it as like, Airbnb for care, right? I mean,
Oh,
where you
cool.
call in, yeah, where you can call in and you can find somebody. Let's say you have a grandfather, Eric, who needs to go to the hospital, and then he needs somebody at home to help him around the house, and he needs somebody to play golf with. These are sort of non-medical stuff, but they really add value to his health and mental health, especially. And so you can
Mhm.
go on the app, and you can download the Tuktu app. And if we have the network in your city, then you can go there and you can find the person who will be the right fit to help your family out.
Did you find that a challenge when you were developing the app and you were specifically looking for housekeepers or maybe nurses? Did you have to reach out to a bunch of people per the network or per the city to actually get them to come on? Or was this an ad campaign that you guys had to kind of run to then pull people, hopefully, to show that, if you aren't working currently, we can give you work by working with our network of seniors and partners, probably with retirement homes?
Absolutely, absolutely. Yeah, I mean it's a chicken and egg problem with the marketplace, right? You need good quality providers to attract good customers and vice versa. So we did have a challenge going out. Marketing works a little bit. It does give us some leads, but essentially we go with sort of champions in the industry, whether it's universities where students are, whether it's sort of stay-at-home moms or retired nurses, retired teachers, retired firemen, basically going to these groups to market to them and have
Hmm.
them come in and become providers. So again, I mean, we are starting in Vermont, in Burlington,
Oh,
and
cool. I've
and
been there.
in oh, awesome, cool.
Yeah.
So Vermont is a great city, a great state, and it's one of the interesting states which has a good community, but it's also an aging population. So
Yeah.
one of the goals is to go ahead and create providers, and that's what we are doing right now is to create the whole provider network. We'll do the background checks, we'll do the onboarding, we'll do the training, and once we have a good network in place, we can essentially then go to care homes and nonprofits and older adults.
Okay. I was going to ask, yeah, how do you screen to make sure that they're actually good providers, one, that they can go through it? So they have to do a course through Tuck2, and that's kind of like a badge, that they have been certified in a way through our screening process. No, obviously, criminal history, and that they're safe to work with others. And people like myself, let's say I was signing up my mother, can I rate the person? Can you go on
Yeah,
and actually like communicate with them and see what their history is?
absolutely. So when you go on the app, we take in certain criterias from you about what you're looking for, what your preferences are, if you're particular about a particular language. We
Oh,
obviously
right.
take your, like, yeah, we take
Very
cultural
important.
values in, and of course we take, your location, what time and date and all that. So it's a multivariable sort of input that we collect from you. We onboard your folks as well. And then we, just at a touch of a button, it goes into a database and finds you the right fit people who could do the
Mhm.
job. You get to see their profiles. You get to see that they've been background checked. You get a little bit of, the certifications they have, the reviews and ratings others have given them. Kind of you'll do it Yelp or something else, right? But in this case, you're doing it for care providers or companions, and then you can book them. Once you book them, these people get notified. They know that they have to show up and they can do the service as required. And then they swipe in, they swipe out, the time is recorded, the invoice is generated. So essentially automating the whole process so that we can make these networks sort of more efficient and yeah, get people help as they need.
Oh, awesome. Yeah, great to hear that. So now you're international, right? Was that a challenge well, obviously the challenge of finding people maybe in the beginning to go international, right? Do you have trusted partners that are abroad in Europe, in the Middle East, in Asia? How is
Not yet.
Tuk2 going to evolve from where it's at right now?
Absolutely. So not yet, of course, but we've been having conversations with some very interesting folks in multiple countries. Right now, we are in Canada and US. We're starting in the US, so that's where our footprint is. But definitely, if you look at aging populations all over the world, there's Japan, there's Germany, there's France, there's Italy. They're all aging quite fast. They have, and their healthcare systems are also pretty stressed out. So
Yeah.
we are talking to a bunch of people around in the world to see if they could get help with our software, with our infrastructure that we've created. So it'll be interesting to see how we grow.
Yeah. Have you networked with doctors and hospitals as well? To use Tuk2 as
We
like a primary option for people?
We do try to break into doctors, and we definitely are very successful with nurses, especially like
Um,
a dispatch nurse or a nurse, a skilled nurse who's let's say you've gone for a colonoscopy and you
mhm.
need help at home after that, and you don't want to sign a contract, and and you just want some errands done or something's done on demand. Those are really cool. We've also, I mean, we get a lot of advice and mentorship from doctors, but we don't have like direct linkages yet with
Mhm.
doctors and or with the insurance companies. But that would be something to build in the future as well.
Oh, for sure. The insurance companies, right? Having accessibility and an option for people is always
Exactly.
important. So, in the next 6 to 12 months, what is on Tuktu's radar? What are you going to be advancing in that time period?
Absolutely. In the next 6 to 8 months on three sides. One is in terms of just footprint, we'll be across the northeast of US, so which is all the New England areas, starting from Vermont, but hopefully going to Maine, New Hampshire, and all these other places. We'll also be bringing on some strong nonprofits as well as care homes and partnerships of that nature on the platform in US. And essentially, we'll be looking at to see how we can make the industry more efficient, and how companion care can really have social determinants of differences and impact that it can be. So that's sort of in the shorter term, in a year 2 years, that we want to see. We're obviously also raising funds, so we'll be raising money to spread across the US and international as well.
Have, you've talked a lot about the social aspect, right? It's really important for seniors to have that social ability. Like if you don't have a car, right, you can't go out even just to do groceries really on your own. Is there any point in the future that Tuktu might be able to do those social gatherings? Like we are having a meetup at this point, and maybe that's facilitated by somebody that's hired by Tuktu. But I think that would be a really interesting, innovative piece where, we provide those, or you provide those professionals to a lot of homes, but maybe meetups. Do you feel like that would be a
We will
next?
probably, that would be the organic next step, Eric, and I think it's a phenomenal idea. Our team been quite excited and thinking about it as well. Is how do we create group events instead of just individuals, right? Like how do we do sort of things of interest? So yeah,
Awesome. Is Tuktu the only one in the market doing this? And if there is other competitors, how are you different than them?
that's a good question. I'm sure that there's lots of other companies which are trying to fight social isolation and provide companionship and support networks. There's a few in Florida. There's a few in Boston and other New York regions. I think the way we are sort of maybe kind of, I mean, it's a big market, so there will be other people as well. But
For
I
sure.
think what we are trying to do is define ourselves by being a platform that is very collaborative. So let's say, Eric, tomorrow you have a service that you want to provide to this customer segment. You can come in and we can help you build your company on our platform, and then you can offer that to the market. So we're trying to be very collaborative. We're also trying to ensure that we are technology first. So a lot of the stuff that is manually done in the industry, like matchmaking and taking in
Mhm.
records and maintaining data, or communicating, we can do it with a technology first approach. So we have AI agents and others who can do that, and so it's a much more efficient and much, I would say, economical way
Mm,
of executing business as well. So we're hoping that's the direction the whole industry will go to, and it'll get more automation and more AI to build it out.
very cool. Yeah, I know we talked a little bit about AI beforehand. I just had a thought, like, do individuals, like, let's say my mother, or maybe just even me for my mother, get a profile on this? So then
Yeah.
would I eventually be able to, within privacy, of course, upload my mother's records? So then maybe a doctor can see them, or maybe a nurse can see them, right? And they can kind of themselves be responsible in that way and keep track, opposed to like, here are her papers, right? It becomes more of an upload PDF. You can hold it there. Is that a part of Tuck 2 already, or is that?
So we do it at the front of. So we are HIPAA compliant. We can hold a certain amount of data, but we can't hold a lot of medical records right now. So we do it at the level of a care home. For example, if you're a care home social worker or a manager at the care home, you'll be able to see what bookings are happening, what's sort of being built out. So we do it at that level, definitely at the level of the family member. So if, let's say, you, Eric, you set up your grandparents, and you and your mom can see what services they are ordering, what they're what they're essentially using. So that definitely happens quite strongly. I think we're not at the stage yet to hold medical records and share it with nurses and doctors. That is definitely in the pipeline in future. as
Cool.
we see more and more requirements for that. Right now, it's essentially for non-medical stuff and for companions. And of course, there's a data that they get to see about the person's preferences, what they like, what they dislike, what car they drive, and what
Mm,
game they play, and stuff which is more, I would say, non-medical, but very important as well.
amazing. Awesome. So you talked a little bit about the innovation of AI. How has Tuktu already innovated AI into its app to maybe get more outreach?
Absolutely. So there's a couple of ways more than outreach. I mean, we do AI for a lot of matchmaking stuff, a lot of communication. So let's say
Oh, cool.
your grandparents have been using tuk-tuk services for a while, and you need to know about them. You could just talk to the AI agent or message us, and it'll tell you back how he's feeling, what he's going through, what services did
Oh,
he take. So it's obviously readbacks from the database, but it does it in a very sort of human computer fashion, right? Like,
cool.
so those are things we currently use. In terms of outreach, we don't have a lot of AI tools for outreach yet. Mostly we get outreach through referrals or through SEO and other kind of stuff. So
Hmm.
that's definitely an area that we like to build in future or work in
Cool.
future.
Well, thank you so much for that information. I always ask my guests if you had to give one piece of vital information to the audience that's going to see this, it could be health, it could be about the relationships you have with seniors, one piece of vital information that would benefit those who are listening, what would that be?
So vital piece of information is that as we have a very crazily increase in the senior population, especially with people living longer, I think one of the things that we have to be mindful of is social isolation and loneliness.
Mm.
And what we see across the platform, across different things, is loneliness and social isolation is becoming an epidemic in some forms. And so if all of us had one thing that we would take away from this was that we all need to start thinking about how we created communities that connect more with each other, and especially try to sort of fight loneliness and social isolation, because they have huge healthcare issues and other social society issues in future.
Well, thank you so much. It is really important. I can very much relate with my past and circuits of life and working directly with seniors now in a patient care format. So thank you, Rustam, again for your time. I really
Thank you.
appreciate you coming on VitalCast and sharing all of your experiences and a little bit more about Tuktu.
Thank you so much, Eric.